So, congenital heart disease is a general term for abnormalities of the heart or great vessels that are present at birth. Most congenital heart disease arises from fault in embryogenesis during gestational week 3 to 8. It is the time when major cardiovascular structures form and begin to function. It can be due to environmental exposure or can be due to genetic abnormalities, which is the major cause of congenital heart disease. Most of these structural abnormalities in the congenital heart disease can be organized into three major categories. Malformation causing a left to right shunt, or it can be right to left shunt, or can be a malformation causing obstruction. Under this left to right shunt, we have atrial septal defect, ventricular septal defect, and patent ductus arteriosus. Under this right to left shunt, we have tetralogy of Fallot, transposition of great arteries, and tricuspid atresia. And under this malformation causing an obstruction, we have coarctation of aorta, pulmonary stenosis and atresia, and aortic stenosis and atresia. In this video, we will be discussing about atrial septal defect, and the rest of the defects we will be discussing in next videos separately. So, this is our normal heart, which has atrial septum and ventricular septum, to avoid mixing of oxygenated and deoxygenated blood. But sometimes there is an abnormal hole or a shunt that may allow mixing of blood. Now, to understand this, we'll take a look at the development of atrial septum during embryogenesis. So, this is a septum primum which grows downward, leaving a hole called ostium primum, first opening. And this septum primum grows till endocardial cushion. Meanwhile, there is a second opening formed called ostium secundum. And beside this septum primum, another septum grows called septum secundum, leaving a hole called foramen ovale. The fetus get oxygenated blood from mother's placenta, and this foramen ovale allows to bypass the non-functional fetal lungs. However, after birth, the baby's lungs become functional. The changes in pressure between two sides of heart force the opening to close. But in some individuals, this hole does not close properly, leading to defect in atrial septum or ASD, atrial septum defect. If the septum secundum fails, then it will lead to secundum ASD, which is 90% of all ASD. But sometimes this septum primum fails to grow all the way down, which may lead to primum anomalies. Now there is one more atrial septal defect. The first one was when ostium secundum was not closing. The second one is when ostium primum was not closing. And now the third one is when this foramen ovale is not closing properly, leading to patent foramen ovale. This was all about the defects in formation during embryogenesis. Now we know that the pressure on the left side is higher than the right side, and because of this, blood starts flowing from left atrium to right atrium, and as the oxygenated blood is growing to the other side, this defect will be acyanotic. Cyanotic means blue and acyanotic means not blue. And the complication is paradoxical embolism. Now, why is it a complication? Because normally, when there was no shunt between this atrium, this emboli was going to the lungs. But now it is going to the left side of heart and from there to the systemic circulation, which means it is now having a higher risk of going to the brain. Thanks for watching. Don't forget to like and subscribe and share with your friends.